Hi, I'm Kristen. Today we're going to talk about cleaning chemicals and how to protect employees and reduce exposure. With concerns over COVID-19, businesses are enhancing their cleaning procedures. When you walk into a store, all of the carts are being sanitized, all of the high-touch surfaces are being cleaned. And unfortunately, West Bend has seen a drastic increase in workers' compensation claims regarding chemical exposures. With increased cleaning of those high-touch surfaces in and around the workplace, it's essential to protect workers by ensuring proper use and self-protection practices. Many cleaning products, even those bought at the store or considered consumer strength, can be harmful. Let's review the definition of cleaners, sanitizers, and disinfectants. Cleaners remove dirt through wiping, scrubbing, or mopping. Sanitizers contain chemicals that reduce but don't necessarily eliminate microorganisms such as bacteria, viruses, and molds from surfaces. Disinfectants contain chemicals that destroy or inactivate microorganisms that cause infections. Disinfectants are critical for infection control in hospitals and other healthcare settings. Disinfectants are generally the strongest, followed by sanitizers and then standard cleaners. OSHA and the CDC recommend selecting the least potent cleaner for the job. The more potent the cleaning chemical, the more hazardous it typically is. Limit exposure to harsh chemicals as much as possible. So how can employees reduce exposure? They need to follow proper storage, handling, and use, including dilution practices of all cleaning chemicals. Make sure you know what cleaning chemicals employees are working with, and have access to use hazard information, such as product labels, safety data sheets, and the poison control number, which is 800-222-1222. Don't allow employees to use a product if they haven't been trained or aren't knowledgeable in using. Make sure the area being cleaned is well ventilated. If necessary, use a fan or open a window. If the smell of the cleaning chemical irritates employees or makes them feel lightheaded, remove them from the environment. Don't allow mixing of cleaning chemicals unless instructed to do so. Some chemicals, like a mix of bleach and ammonia, can be toxic and cause serious damage to skin, eyes, and lungs. Don't allow washing skin with cleaning chemicals. This could result in skin irritation or chemical burns. Now let's talk about PPE, or providing appropriate personal protective equipment to employees. This is crucial. They should have access to gloves when handling wet, dry, or aerosol-based chemicals, long sleeves when chemicals may splash the arms, eye protection when chemicals may splash up, and a smock when chemicals could splash towards the torso. And finally, be sure to direct employees to always wash their hands after handling cleaning chemicals, and also to avoid eating, drinking, or touching their face, skin, and eyes when working with any kind of chemicals.